Welcome back to Midday. We are here in the kitchen with Dr. Jennifer Dyck, naturopathic physician who joins us once in a while, and it's always a pleasure to have you on the show, Jennifer.
Thank you. Thanks for having me.
Of course. Today we're talking about adrenal burnout, which I think is quite timely too with the start of a new year and people are trying to, figure out their priorities for the year. We were just talking to Sandy about financial things that could bring make your adrenals a little out of whack. But maybe just explain first of all about these two glands. They're really important.
They are really important. They sit above our kidneys. There's one on each side. And they create and secrete a lot of different things, a lot of hormones. Most of us, I'm sure all the viewers are familiar with adrenaline.
Yes.
That's where the name comes from, right? That's secreted by the adrenal glands. That gives you that fight or flight sensation when you're supposed to run away from that bear or fight a tiger.
My goodness. What kind of life are you living, Jennifer?
My adrenals are shot, let's just say. No. But we actually secrete adrenaline on a regular basis when we shouldn't, right? So when you're in the car, if you've got, you're in a traffic jam, or you've got a deadline, or you've got stuff going at home.
Stress, like high anxiety situations?
It creates that stress, right? It creates that reaction to what you're exposed to. But we're not really supposed to be exposed to that type of stress on a regular basis. So that's adrenaline. That's what we feel, right? We feel that. But we then about 2 hours later have an increase in cortisol. That's the hormone that the adrenals secrete that a lot of us think gives us the stressful sensations, but cortisol actually comes in 2 hours later to calm everything down.
Okay.
The problem is when you're under stress for extended periods of time, the adrenals get tired, and then the cortisol has been high for a while and then significantly drops, causing a lot of issues. I always ask my patients, are you refreshed when you wake up? If you're not, even after 8 to 10 hours of sleep, you probably have low cortisol.
That's
if
interesting.
you've gained weight around the waist, that spare tire effect, we say that's high cortisol in the beginning, but if you can't lose it, it's because your adrenals are now too tired to cope and your cortisol is actually too low.
So how do you manage that then? I mean, what are some of the steps that you should take to really get your body back and have it sort of tick the way it should?
Exactly. Well, start with sleep. We start with some of the basics. So I brought this cute little sleep mask in. So
see, you can even look cute when you're sleeping.
I take that with me when I travel. So not so much of an issue at this time of year, but especially in the summer months if you don't have blackout blinds. Light is what stimulates your melatonin to shut off. So if you have light stimulating your brain, your melatonin will shut off, your sleep will be disrupted, and that can affect your cortisol and your adrenals. So getting enough sleep, there are supplements that can help calm the mind so you fall asleep and stay asleep. So that you get more restoration throughout the night.
Okay, and I see you have brought some exercise.
Yes.
You're really telling us
some
that we need to exercise.
So too much is not always a good thing too, because too much exercise can also increase your adrenaline and increase your cortisol and put a strain on the adrenals. So, doing what your body likes, find an activity you enjoy. Weight training, yoga is always very, very good because it's a good stretch. It also helps with breathing techniques.
Does it matter what time of the day you work out? I mean, is there, you say if you do too much exercise, it could affect your sleep. So maybe not late at night?
Sometimes late at night you need that time to calm down afterwards. I just say whatever you can get in because a lot of people don't get enough exercise. So as long as you do get something in, then I'm happy.
Okay.
Yeah.
And food is a huge thing. Obviously, food controls a lot of our body and it makes us go. But there's things that you can eat to really keep your adrenals intact, right?
Yeah, so vitamin C is very important for the adrenals. So we've got, bell peppers and oranges there, pineapple, high in vitamin C, vitamin B5 and potassium also important. That's, a good source is found in avocados. We've got green leafy vegetables, whole grains, lots of fiber, filtered water, healthy fats. And because the adrenals also produce other hormones in our body, if you're consuming animal products, do try, if you can, to get hormone-free, antibiotic-free products, free-range eggs, and I've got some turkey there. Those are good examples.
Okay, so eat healthy, pretty much is what it comes down to.
Exactly, eat healthy.
And eat properly during the day, right? Have those proper meals. Don't just starve yourself and then all of a sudden.
Yes.
Yeah. What are some of the things that adrenal burnout can really lead to? I know you mentioned that you can feel anxious or stressed, but is there some more health impacts that could have that are are more serious?
Absolutely. So anxiety and depression are two that we see quite often. We see the weight gain that starts around the waist, but then that can also affect your blood sugar levels. So that can also lead to complications and prediabetes. We see the immune system, coming down. That activity is less, wound healing.
Right.
Blood pressure can go up. So a lot of things that we don't really want to have to deal with as we get older. It's best if we can, prevent as much as possible.
Yeah.
Eat well, supplement as needed, and really just, find out where your levels are. It's also important to know how your adrenals are doing so you can target that specifically. Some people, again, high cortisol. Others have that burnout, and you want to try to find out where you are. You can do different types of testings through your naturopathic doctor. There's actually a really great questionnaire. We have it at health food stores now. It's actually created by a colleague of mine, Dr. Marina Show. So you can also look at things like that to try to determine where your levels sit and what is best for you to do to combat that.
I noticed that this says women's health, but are we more prone to having that burnout, women?
I think traditionally no, but in today's days, yes. We also see that when you have adrenal issues, it can also affect our hormones more specifically because we do have that big shift called menopause. And so the adrenals take over for our ovaries at that time. And so if our adrenals are not up to par, then we can also see changes in our sex hormones, which can increase symptoms in menopause.
Okay, one last quick question for you, Jennifer, before we run out of time. If you are worried about your adrenal levels, what would some of the main signs be right off the bat, just for anyone watching at home?
So so levels of stress that you can't cope with, for sure. We see unrefreshed when you wake up, right?
That's a big one.
Even after that 8 to 10 hours of sleep. So if you just feel like I could stay in bed for another few hours, that's an issue. I also test people's blood pressure.
Okay.
And when the adrenals are too low, we'll actually see a drop in blood pressure.
Okay, great. Yeah. Excellent. Thank you. You got us thinking. And if you want more information or get a hold of Jennifer, there's her information on the screen. Make sure you check your adrenals. Figure out if they are balanced and what is best for you and what works best for you. And eat healthy and exercise. It all comes down to that, right?
Yes.
Always. All right. Thanks, Jennifer. Thanks. We're back in a couple of minutes with the Film Society talking about the latest winter film series production, which is, of course, tomorrow night. Stay with us.